Did you know that in 2022 there were almost 20 million deaths from cardiovascular diseases globally? Out of this, 85% were from heart attacks and strokes. Hello everyone and welcome to another episode of Sunday Wellness by Policybazaar. Today we are joined by Dr. Rahul Singhal from Fortis Jaipur, who's a leading cardiologist, and he'll be telling us ways to prevent strokes, heart attacks, and how to maintain a good heart health. Hi doctor, thank you so much for joining us today. To begin with, I would like to understand from you what exactly is a stroke and how does it affect your body and heart?
Stroke means paralysis. So, like you have heard about the heart attack. हार्ट अटैक में जैसे हार्ट की आर्टरीज में ब्लॉकेज होता है, ऐसे ही ब्रेन की जो आर्टरीज होती हैं जो ब्लड सप्लाई करती हैं ब्रेन को, अगर उसमें देयर इज़ ऑब्स्ट्रक्शन, देयर इज़ स्टेनोसिस, ब्लड फ्लो में रुकावट आती है, तो उसकी वजह से उस पर्टिकुलर एरिया में ब्रेन का फंक्शन कम हो जाता है, जिसको हम स्ट्रोक बोलते हैं, या सामान्य लैंग्वेज में या कॉमन लैंग्वेज में जिसको हम बोलते हैं पैरालिसिस. सो ये दो तरीके से हो सकता है, या तो ब्लड का जो फ्लो है वो रुक जाए, या ब्लड कोई आर्टरी है सडनली रप्चर हो जाए ब्रेन के अंदर बिकॉज ऑफ देयर मे बी सो मैनी रिस्क फैक्टर्स that I will be discuss in later on in my discussion. तो उस दौरान जब ब्लड ब्रेन के अंदर पहुंच जाता है, तो जिसको हम इंट्राक्रैनियल हेमरेज भी बोलते हैं, तो उसकी वजह से भी स्ट्रोक हो सकता है. तो मेनली देयर आर टू इम्पॉर्टेंट रीजन्स ऑफ स्ट्रोक. One is the reduction in the blood supply to the brain, and second is the basically rupture of one of the important arteries of the brain, leading to hemorrhage inside the brain.
Doctor, I've heard that lifestyle plays a huge role in your heart health and in preventing strokes. Can you throw some light on it?
Lifestyle definitely plays an important role, because when the patient comes to us or to the neurologist for stroke or for heart attack, basically the disease has already set in. So now it's a time to get the treatment, and most importantly, over and above the treatment is the lifestyle management. So lifestyle definitely plays an important role, particularly in the current scenario, because mostly the Indian population had becoming more and more westernized in their lifestyle, in terms of that there is lack of physical activity, good amount of saturated fats, junk foods, packaged foods we are consuming, lot of sugars we are consuming. Then other risk factors like uncontrolled sugar, uncontrolled blood pressure, then basically smoking, alcohol. So these are all the things which comes in the lifestyle. So if the lifestyle is not good, there is lack of physical activity, there is lot of saturated fat, junk foods, and uncontrolled risk factors like blood pressure, diabetes, high cholesterol or overweight. All these can lead to major risk factors involving the brain as well, leading to stroke.
डॉक्टर, आजकल यंग लोगों में हार्ट अटैक और स्ट्रोक्स के केसेस बहुत देखने को मिल रहे हैं. ऐसा क्यों हो रहा है? कैन यू टेल अस अबाउट इट?
As I've told you earlier in the discussion, because a lot of things we are imbibing from the Western countries, and in particularly we are basically imbibing the bad habits in terms of that we are having almost sedentary lifestyle with no amount of physical activity. We move in AC cars, we come to office, then go back to home, and everything is basically being mechanized. So there is less time left for the good amount of physical activity, and most of the time we consider physical activity what we do during our daily routine. So that is not considered to be a physical activity for the heart or the brain. The most thing that comes in the physical activity is when you spend time for yourself. So you have to go basically for 30 to 45 minutes of physical activity by jogging, walking, running, whatever in form you can do. So that's why the younger population in particularly, because in the younger population we are getting more of the risk factors in the present time, which were used to be the disease of elderly, like for example high blood pressure. It always used to be the disease of after 50s, but now most of the young patient coming to us are having high blood pressure. So high blood pressure, uncontrolled diabetes, cholesterol is getting more and more common in the young population. Then lack of physical activity, then lot of stress, in the younger population because of the competition, because of the involvement of large amount of alcohol habits like smoking and substance abuse. And in particularly in the younger population, gymming has now become an important factor in which basically a lot of protein supplements they are taking just to improve the exercise performance. So all these basically in over excess basically which they are doing causes them basically make them vulnerable for the all forms of problem, including the heart attack as well as the stroke.
Now, doctor, my next question is actually one of the most important ones in this entire discussion, according to me. I want to understand from you, how can someone recognize that they are having a stroke and it's not just anxiety or acidity or something else? How is it that they know that, okay, I'm having a stroke? And once they realize that they are having a stroke, what is it that they should do in the next 5 to 10 minutes?
Neurologist and Neurological Association had usually come out with a synonym BEFAST. Most importantly, the fast. BEFAST, there is a synonym, acronym which we say. This is acronym. B means balance, loss of balance. Then E basically stand for eye changes. But most importantly is the fast now. Fast means firstly the facial abnormality, like there is deviation of the mouth, drooling of saliva. Then abnormality in the arms, like one of the arm is not moving at all, it is getting weak, it is not, patient is not basically able to grip something. Then S stands for basically speech, like slurring of the speech, patient is not able to comprehend basically precisely, like somebody asks his name, then he is not able to tell, or he is telling in a basically breaking way. So this is some, and T is basically stand for time. So since like we say in the, as a cardiology we say heart is time is a muscle, because heart is basically a muscular organ. So if the patient has a heart attack, then time is very important. So immediately if the patient is not getting the medical attention, then heart is going to basically get weaker. Similarly in stroke, the time is very important, and therefore once you are able to recognize these symptoms which I had basically told you about, be fast. So time stands for basically to act fast. So you can dial 911 basically for the medical help. And suppose you know what type of the symptoms you are having, then definitely in like for the heart patient we say you should keep these medications like ecosprin or disprin, clopidogrel and statin in your home. So whenever if you are able to recognize these symptoms, and so if somebody is with you and you are conscious, alert at all, so that you can take the medication, then you should take ecosprin and clopidogrel immediately, so that if it is the stroke is mainly occurring because of some obstruction in the blood flow because of the clot inside the brain arteries, then definitely over a period of time this clot will dissolve with these tablets, and patient may recover sooner as compared to those who do not take this. So this is the first aid, but I am not saying that everybody should take it. They should watch their symptoms, they should be alert in taking the medication, otherwise these medication can go inside the respiratory passage, lungs, and may cause further harm. So it is basically a discretionary judgment to be taken at that particular time. But most important thing is to watch your symptoms, and I have basically told you about the acronym. So if you follow this acronym, you will be able to judge what type of the problem you are having neurologically, and immediately call for the medical attention.
Now, doctor, do you think that genetics also have a role to play here when it comes to having strokes?
Yeah, genetics play also a very important role, particularly neurological problem, particularly if the patient is having neurological disease after 65 years of age, then genetic predisposition plays a very important role, because in the history we always ask for the family history. Uh, so family history is very important, because some of the genes might be carrying from your parents, from your brothers, from your sisters in your family. So, and there are also some genetic problems in the neurology, which is gene disposed, like you can say basically polysaccharidosis, galactosidase deficiency, and there are lot of various other neurological problems related to like hypokalemic periodic paralysis. So all these are basically genetic related, which usually occur because of the gene mutations. Family history therefore is very important because we can basically screen not only the patient but the entire family members, so that we can come to know about that who are genetically predisposed. और इन पेशेंट्स को फिर हम अर्ली अगर स्क्रीन कर पाएँ और वी कैन कम टू नो अबाउट द जेनेटिक डिजीज so that we can treat them early so that they don't end up in the active form of the disease.
Now डॉक्टर आजकल स्ट्रेस बहुत ज़्यादा बढ़ गया है, लोगों का बहुत ही सेडेंट्री लाइफस्टाइल है. Before we end our discussion today, I want to know from you what are the top 3 ways one can prevent strokes and have a healthy and a happy heart.
In all the forms of disease, whether we are dealing with heart attack, stroke or any other problems. So I've already told you about the heart and brain connection. So they are very much directly connected, and whatever is occurring inside the heart, it is definitely going to affect the brain. So the 3 important basically habits that is important so that we can prevent the stroke, the heart attack is the good lifestyle management. So that is something very, very important. And in my view, the good lifestyle management comes basically in 2 important points. The first is the diet. So take care of your diet. Avoid saturated fats. Consume lot of fresh fruits, vegetables, nuts. Avoid packaged foods. Second important thing in the lifestyle management is basically take care of your physical activity, because in the present time, like you have said, for in the fast moving time, in the present scenario, we are basically having a lot of sedentary lifestyle. So be active, get up early in the morning, go for yoga or go for aerobic exercise. So that will create a great difference in your body and vulnerability to the disease. Second important thing is identify your risk factors. So that is something very important. Like any disease, it usually starts very early. So idea is basically to identify those risk factors. So I've already highlighted very common risk factors like blood pressure, diabetes, high cholesterol, overweight. So excess of salt intake, then alcohol, smoking. So these are all the common risk factors. And therefore, once you are able to identify that each of these risk factors basically doubles or triples the risk of heart attack or the stroke, so definitely if you are able to control these risk factors, you will be will be prevented from having the stroke. And third important thing is, once you are able to perform all the lifestyle management, able to identify the risk factors, the third thing is do not ignore the symptoms. So that is something very important, that even the slightest symptoms you are having and you are in extreme doubt that it may be part of the heart, it may be part of the brain. So just do not shirk away, do not shame or do not basically overlook your symptoms and report early to your doctor. So in most of the time it has been seen, the earlier you report your symptoms, maybe you may not be having a very basically advanced form of the disease, and you might be just getting the advice from your doctor to perform your basically good lifestyle, and no medications further may be required. So that is something very important, the lifestyle modification, identification of the risk factors, and do not overlook your symptoms, and report immediately to your family doctor so that you can get the treatment at the as early as possible.
Dr. Rahul, thank you so much for joining us today. And I just want to end today's session by saying one last thing, that you can have 100 problems in life until you have a health problem. And then you really have just one problem in life. So take action today when you're fit and you're healthy until it's too late. Have a good day and stay tuned to Sunday Wellness by Policybazaar.